Imagine for a moment a world without pain. You could touch a flame without flinching, keep walking on a fractured leg, or never notice that life-threatening appendicitis. It sounds idyllic, doesn't it? But the harsh reality is that in that world, your life expectancy would plummet. Pain is not your enemy. It is the most sophisticated and ruthless alarm system your body could possess. It is a sense as crucial as sight or hearing, whose sole purpose is to keep you alive. Today, we are going to delve into the depths of this mystery. We will dismantle, layer by layer, the biological machinery of pain. And on this journey, you will face an uncomfortable question. What if I told you that much of the pain you suffer, especially persistent pain, is not in your tissue, but in your brain? It all begins with an aggression, a pinch, a blow, excessive heat. In that instant, in your skin, your muscles, your organs, small specialized nerve endings spring into action. Nociceptors. They are the sentinels of your body. Their mission is to translate that real or potential damage into a language your nervous system understands, the language of the electrical signal. This first step is called transduction. But these sentinels are not alone. When tissue is damaged, a chemical cocktail is released: bradykinin, substance P, prostaglandins. It's as if an alarm sounds, and at the same time, gasoline is poured around. These substances not only activate nociceptors, but also lower their activation threshold, making them hypersensitive. This is why, after a blow, even the lightest touch hurts. It's a phenomenon called hyperalgesia, and it's the reason the area around a wound becomes so sensitive. Now the danger signal is traveling. How? Through two main types of nerve highways. First, like lightning, travel the delta fibers. They are fast, myelinated, and alert you with a sharp, well-localized, stabbing pain. It's the pain that makes you pull your hand away from a hot pan. It's a survival reflex. Then, the second wave arrives, slower but more persistent, the C fibers. These are unmyelinated fibers that conduct the impulse more slowly and transmit a dull, burning, diffuse pain. It's the pain that throbs after the initial impact. This is the famous phenomenon of two pains. First a fast, sharp pain, followed by a dull, lasting sensation. All these signals converge on a control center, the dorsal horn of your spinal cord. It is here that one of the most fascinating parts of the entire process occurs: modulation. Imagine a gate that controls the flow of painful information to your brain. This is the gate control theory. What can close this gate and relieve pain? Signals from non-painful fibers. For example, when you bang your elbow and instinctively rub it. That rubbing activates tactile nerve fibers that send a positive signal that closes the gate to the painful message, partially relieving the sensation. Your body has its own analgesia system, and this is where endogenous opioids, your natural morphine, come into play. Endorphins, enkephalins, and dynorphins. These molecules are released, and by binding to their receptors, cause a hyperpolarization of the neuron, which basically means they calm it down, making it much harder for it to transmit the pain signal. But the signal that manages to pass through this gate embarks on a final journey. It ascends the spinal cord, crosses to the opposite side, and travels via the spinothalamic tract until it reaches the thalamus, the great information distributor of the brain. From there, it is projected to multiple areas of your cerebral cortex. And it is at this moment, only at this moment, that pain becomes a conscious experience. Not in your finger, not in your back, but in your brain. Different regions light up. The somatosensory cortex locates the pain and tells you if it is stabbing or burning. The insula and the anterior cingulate cortex handle the unpleasant emotional charge, the suffering. And the prefrontal cortex assesses the threat, processes it with your memories and expectations. Pain is therefore a brain construct, an interpretation of an alarm signal. And this brings us to the heart of the debate. the element that completely changes the way we view chronic pain. If pain is an interpretation by the brain, can this system fail? Can the alarm keep ringing long after the fire has been extinguished? The answer is a resounding yes. This is neuropathic pain and chronic pain. Sometimes, after an injury, the nervous system undergoes reprogramming. Neurons become hyperexcitable, as if in a permanent state of panic. Receptors become more sensitive, transmission pathways are amplified. The brain learns to feel pain. It is no longer a symptom. It is the disease itself. It loses its alarm function and becomes an internal torturer. This is the case with chronic migraine, trigeminal neuralgia, or persistent low back pain. The initial injury may have been minimal or even healed, but the pain circuit has gotten stuck in the on position. Let's apply this to a universal example: the headache. Most are not brain tumors. You know why? Because the brain has no nociceptors. It doesn't hurt by itself. A tension headache, the most common, is often the result of a muscle contraction in the neck and scalp. Those contracted muscles activate the nociceptors in the area, and the brain interprets that signal as a pain that seems to originate in the head. A migraine is much more complex. It involves an abnormal activation of nerve pathways and the release of substances that cause neurogenic inflammation around the blood vessels of the brain. And then there are cluster headaches, so intense they are called suicide headaches, with pain localized around one eye, with tearing and congestion. In all cases, the final mechanism is the same: an erroneous or amplified signal that the brain translates as pain in the head. So if pain is a construct of the brain, can our mind influence it? Absolutely. Context is everything. A soldier wounded in battle may not feel his pain in the heat of combat because his brain, flooded with adrenaline and endogenous opioids, prioritizes survival. The same wound in a context of peace would be unbearable. Anxiety, fear, and depression swing the pain gate wide open. Conversely, calm, distraction, and a positive attitude can help close it. Psychological therapies, like cognitive behavioral therapy, don't cure the lesion, but they teach the brain to reinterpret those signals, to turn down the volume of the alarm. This leads us to treatment. There is no magic bullet. Modern pain medicine is multidisciplinary. We follow the WHO analgesic ladder, from anti-inflammatories like ibuprofen, which act in the periphery, reducing the chemical cocktail that activates nociceptors, to opioids, which mimic our endorphins by closing the gate in the central nervous system. But there are also adjuvants, antidepressants and antiepileptics, that calm hyperexcited neurons in neuropathic pain. And beyond drugs, there is physiotherapy to correct muscular problems, injections to block specific signals, and cutting-edge techniques like neurostimulation, which uses electrical impulses to interfere with the pain signal. The future lies in personalized medicine, in finding biomarkers that tell us exactly which mechanism is failing in each person to treat it with precision. We have reached the end of this journey. From the spark in a nociceptor to the storm in your brain, pain is a physiological, emotional, and cognitive journey. It is real, it is complex, and it deserves to be understood. The next time you feel pain, instead of cursing it, try to listen to it. It is the most intimate conversation between your body and your brain. But this conversation doesn't end here. Now it's your turn. Have you experienced pain that seemed inexplicable? Do you think society underestimates the power of the mind in pain perception? Tell me in the comments. This is a safe space to debate. If this video has helped you understand your body better, give it a like, share it with someone who needs to hear this, and subscribe to keep exploring the mysteries of biomedicine. There are many more topics to discover, and your suggestion could be the next one.